to create the focused light from the source of the light. So we use this ophthalmoscope usually with the simple lamp and like reflecting the light from the lamp into the eye, and having the reflex and can observe the eye fungus. Also, we have the electronic ophthalmoscope, or it also called straight ophthalmoscope. The source of the light is inside of this tool, and we can do the direct and indirect ophthalmoscopy both with it. So I don't have a lamp over here, so I will show you with the electronic one, but with the mirror one is looking the same. So we also have two lenses. The one is 13 diopter, the second one 20 diopter. So to see the more wide view field, we need to use less lens. So 13 diopter. To check the details of some impairment on the eye fundus, we need to use lens with bigger magnifying power, which is 20 diopter. For training, for trying to do the ophthalmoscopy, you better to use 13 diopter lens because it's easier than with 20. So remember, you need the 13 diopter lens and mirror ophthalmoscope or electronic ophthalmoscope. To do this examination, we have to put the patient in sitting position, and the source of the light, if we're doing it with the mirror ophthalmoscope, should be on the left from the patient. So the left shoulder next to the source of the light. By using the electronic ophthalmoscope, we just standing in front of the patient. And first we need to see the optic nerve disc head. To see the optic nerve disc head on the right eye, we need to ask patient to look at our small finger of our right hand. In this position, the eye is turned a little bit, and the optic nerve is not placed centrally. It's placed a little bit to the temporal position. So in this position of the eye, we can actually see the optic nerve disc head, and asking the patient to look at the small finger. Then we are sending the light inside of the pupil and trying to see the red reflection from the eye fundus. So as soon as we see the red reflection, we are putting our lens between our eye and eye of the patient, and moving it back and forth, trying to see some details from eye fundus. After we saw something, for example, some vessels or optic nerve, we are doing like observation of this part, checking if there is any impairment or pathology at the place of the retina we can see it. So first we check the optic nerve disc head. After that we need to check the periphery of the retinas, and to see that we asking the patient to look in different direction. First one, the patient is looking up to the look up, please. And we are doing the same, see the reflection, and after that we are putting the lens and trying to focus the picture. After we take a look at the lower part of the retina, we are asking patient to look to the right, then down, repeating the same stages once again, and to the left. After we check the optic nerve disc head and periphery of the retina, we need to check the macular space. It is the less pleasant part because the light is too bright and the patient is not comfortable with that. That's why we're doing this in the last stage. And asking the patient to look straight to the source of the light. And then we are doing checking of the macula. So after we do that, we need to do another eye. To see the optic nerve disc head from the left eye, we need to ask patient look at our ear, or earring is it if you have one. So please look over here and do the same. Having the red reflex and seeing the optic nerve and the vessels. I will ask him to look up, to the right, to the down, to and straight to the right. So after that, we can do the conclusion of checking eye fundus. What we need to describe? We need to describe everything we saw. First, we need to describe object notice. We can say that it's light pink in color, have sharp margins, and surrounded by vessels. The vessels are arteries and veins are normally in size and the way they are directing. Also, we need to describe the retina, so there is no pathologies in the retina. The maculas have good red reflex and no dystrophies or any pathologies at the eye fundus was seen. I have presentation. There is description of normal eye fundus. You will have time to read it again, to check the picture before the practical skill exam, because you will be needed to do this exam. To do this examination is actually hard. So it's taking maybe 6 months to have the skill to do the ophthalmoscopy, especially with the mirror ophthalmoscopy. So what you have to try to learn is how to see the red reflex. Everybody knows about red lights and the pictures. So this is actually a red reflex from the eye fundus. The flash is getting into the eye, is reflected from the eye fundus, and is seen at the picture and the photo after. So we need to see the same red reflex. We are sending the light inside of the eye. It is reflecting from the retina and getting out of the eye. What we do with the lens, we are focusing this image into our eye to make the eye fundus see. So during your own training, we can enlarge somebody's pupils, because when the pupils are wider, it is easier to see something on the eye fundus. When the pupils are small, the space we can observe the eye fundus is also small, so better to enlarge somebody's pupils. And I remember that I told somebody at the lesson when we were studying refraction, I told somebody to be, you? Okay, so this could be you. You will have lower visual acuity for 6 to 4 hours. And the picture will be blurred a little bit because of white, and after that it will be back again, okay? So any questions about that? 6 to 4. So 4 hours. So you need to do something during this session?